Today, we are going to study the classification of diabetic retinopathy in a simple, high-yield way. Do not start by memorizing every retinal lesion separately. First, ask one question. Are there new abnormal vessels or not? If there are no new vessels, this is non-proliferative diabetic retinopathy, or NPDR. If new abnormal vessels are present, this is proliferative diabetic retinopathy, or PDR. Diabetic macular edema, or DME, is not a separate stage. It is a modifier, because it can occur with either stage and tells us about the risk to central vision. In non-proliferative diabetic retinopathy, the retina is already affected, but it has not started forming new vessels. The basic problem is damage and leakage of small retinal capillaries. That is why we see microaneurysms, retinal hemorrhages, hard exudates, and retinal edema. The key phrase is damaged retinal vessels, but no neovascularization yet. Microaneurysms are tiny outpouchings of retinal capillaries, and are often the earliest visible sign. Retinal hemorrhages are small bleeds inside the retina, often dot blot type. Hard exudates are yellow waxy lipid deposits left behind after chronic leakage. So microaneurysms and hemorrhages suggest vessel damage, while hard exudates suggest leakage. Now the ischemic clues. Cotton wool spots are white fluffy retinal patches caused by small areas of ischemia. They are microinfarcts of the nerve fiber layer. Retinal edema means fluid leakage into the retina, and if the macula is involved, vision may fall. Venous beating means irregular, sausage-like dilatation of retinal veins and suggests worsening ischemia. IRMA means intraretinal microvascular abnormalities. These are abnormal shunt-like vessels within the retina and suggest severe non-proliferative disease. Now remember the classic exam rule. Severe non-proliferative diabetic retinopathy follows the 4-2-1 rule. Any one of these is enough. Hemorrhages or microaneurysms in 4 quadrants. Venous beating in 2 or more quadrants. Or IRMA in 1 or more quadrants. This is high yield because severe non-proliferative diabetic retinopathy means advanced ischemic retinal disease, even without new vessels. In proliferative diabetic retinopathy, the defining feature is neovascularization. The ischemic retina releases VEGF, vascular endothelial growth factor, and new fragile vessels grow on the retina, optic disc, or iris. These vessels are abnormal and bleed easily. That is why proliferative disease can cause vitreous hemorrhage, fibrosis, tractional retinal detachment, and marked visual loss. Finally, diabetic macular edema is not a stage. It can occur in non-proliferative or proliferative disease. It means swelling at the macula, and vision is especially affected when the foveal center is involved. Final pearl. Classify diabetic retinopathy by new vessels, then check the macula. The stage tells you disease severity, and macular edema tells you central vision risk.